Hello, namaste, and a very good evening to all the viewers. You must have heard of the adage, health is wealth. If you asked me, health is more than wealth. Because if you lost your wealth, you can always make up for it. But if your health is lost, everything is lost. Dear viewers, welcome to the third episode in our series, Health and Wellness. In the first two episodes, we touched on various topics related to an India that is on the rise. We discussed how India has made strategic use of technology to break through several immense problems that were considered to be hopelessly difficult in a very short time. This time, we focus on a topic that is important to each of us anywhere in the world, and that is health care. More importantly, wellness for a long and productive life. Ayush, as India calls the ministry and its programs, we have a new guest in our panel, Dr. Shiv Shankar Sastry, who's a surgeon. And he joins us from Bangalore, where he has been a cardiac surgeon for over 45 years. His medical education was in India and the United Kingdom. And of course, we have Dr. Narayanan Komerath and Nivedita Haran. Please welcome our esteemed panel. Hello, everybody. Namaskar.
Hello.
Welcome, Dr. Shastri, to our
Thank you.
episode. Thank you so much for joining us in such a short period of time. Welcome, Dr. Narayanan, and welcome, Nivedita. Very nice to have you all back on our third episode. So, this particular episode is about health and wellness. And my first question goes to Narayananji. Narayananji, how did we pick this topic?
So, namaste. Back in July 2019, which seems so long ago, we held the first Abdul Kalam conference. It was called a roadmap for sustainable growth at sustainable cost. One of our working groups was called a Global Alliance for Wellness and Healthcare. What we started discussing there has come sharply into focus today. We don't take any credit for it. I wish the last 2 years had been much better, but the last 2 years have stressed all medical systems to breaking point. Many superstitions and much arrogance about superiority of this or that system have been debunked, crushed, I should say. But some brilliant solutions have also emerged. And again, India has leaped far ahead beyond all expectations. I say this sitting on the other side of the planet, but my colleagues here speak from personal experience and deep knowledge. Today, the Indian government and states such as Uttar Pradesh, whose population exceeds that of the United States, are moving to bring a decent level of wellness and healthcare to all their people. This is opening opportunities with large implications and, of course, hurdles. Medical care is currently administered by the allopathy community worldwide. They're considered to be mainstream all over the world. They make the rules, whether it is the World Health Organization, WHO, the United States and UK medical establishments and their journals, and the Indian Medical Association in India. And the allopathy system is broken, particularly in the West. That's a radical statement, but I believe it summarizes the present situation. Let me give you an example. Dr. Sai Balasubramanian, an MD, recently wrote in Forbes magazine, which is no friend of India as far as I know, on this issue. He cited data from a recent report done by the Harvard School of Public Health, which I suppose the name Harvard brings an aura of credibility. And that article report makes these points. Quote, India spends approximately $40 per person annually on healthcare, while the United States spends approximately 8,500. However, Indian healthcare outcomes have been found to be comparable, if not better, than its contemporaries, though its spend per patient was much less. Now, spending only $40 per patient is not a sign that medical care is reaching everyone. Far from it. In India, too, the present allopathy led system has severe problems. To me, I'm not a medical authority of any sort, but it's like watching a design process on an aircraft design project, say a supersonic aircraft, where everyone is pointing fingers at everyone else. As in, my part is working and we work hours so hard and we are so successful, but their part is not working. They're broken. And this goes around the table. When this happens in aerospace, we say that the design does not close. That plane is not going to fly. It's back to the drawing board. So, my point here is this: the allopathy led establishment is not likely to solve those problems by themselves. In other words, for people in India to receive excellent wellness and healthcare, implementation cannot be left to the present allopathy medical establishment. But India has two treasures. The first is Ayurveda, that everybody has heard about. The second is a very modern telemedicine portal called e-Sanjeevani something, and excellent connectivity, which is growing every day. So let's use these.
Well, that was very well explained. So, would you like to list some of the problems? And I would actually direct this question to Dr. Shiv Shankar.
Thanks very much for letting me in. It's an honor to be speaking here. Good morning or good evening or whatever time of day it is over here. You'll have to pardon me because I'm going to be brief, but I did make some notes so that I wouldn't leave out what I wanted to say. So this is a huge issue, and I'll try and be brief. The fundamental issue is that modern allopathic medicine is a bottomless pit. It fails to address a huge percentage of healthcare issues, or it does so in an expensive and unfriendly manner. Modern medicine is like the sales department of a manufacturing company. It's expected that profits keep on going up. In the case of medicine, it's survival and cure rates have to keep on going up on the graph, and death rates have to keep on falling, just like losses are expected to be falling. And this simply does not work in healthcare. In fact, I believe that there is a lack of realization at the highest levels in India that trying to meet the doctor-patient ratios that are dictated by Western nations is creating hundreds of medical colleges and tens of thousands of doctors who can only practice in a high-tech medical environment. Let alone rural areas, even tier 2 and tier 3 towns lack basic medical specialists in internal medicine, general surgery, pediatrics, obstetrics, where cities have a surfeit of super specialists without adequate workload. In fact, if I look around me, 5 kilometers in Bangalore, there are super specialty hospitals where we have each hospital is 2 or 3 liver transplant surgeons, and they're not even doing one liver transplant a month. So there is obviously an imbalance. Allopathic medical education actively teaches contempt and derision of systems such as Ayurveda. Ironically, modern medical practitioners who constantly chant the mantra of evidence-based medicine really have no evidence to show why they have this contempt for Ayurveda. However, Ayurveda and alternative medical systems cut into the patient load of allopathic practitioners, leading to very real economic reasons. That is to say that if the allopathic medical practitioner who's probably paid several crores for his medical education, he finds the Ayurvedic guy taking away his patient load, he is going to get upset about it. So unfortunately, Ayurveda and other systems offer non-intrusive, non-invasive methods of treatment that actually work in a very large percentage of cases. And it's the failures that are highlighted by allopathic medical practitioners. Now, since even the richest nations on earth can't afford 100% healthcare for populations that are much smaller than India, it makes eminent sense for India to incorporate Ayurvedic practitioners. Uh, in fact, incorporating Ayurveda into a primary healthcare system with bridge courses for the Ayurvedic practitioners to learn allopathy would be a good idea. On the flip side, allopathic teaching has to acknowledge that the reach and efficacy of Ayurveda exists, whether they like it or not. And I think Dr. Narayanan, who is an old friend of mine and is very modest, has something further to say about this, and I would like him to add over here. Thank you.
Thank you. So I'm just going to summarize what I have heard from my doctor friends. And let's look at the problems of the allopathy establishment that they cite. At the top level, I'll cite four things. One is the shortage of hospitals, clinics, and doctors to staff them, especially in the rural areas. Second, the extreme expense of medical help. Anywhere in the world, and the United States is beyond extreme in that. The nightmare of the insurance business. Insurance is very good to have, but it's a nightmare. And the last, I'm going to say the corruption in medical research.
Mhm.
So let's take each of these. First, in India, not enough doctors. Why? Well, there are too few merit-based seats in Indian medical colleges. There are management seats which are extremely expensive and not necessarily given on the basis of merit. Some people say, I don't have personal experience of this. My doctors are all excellent. The dubious standards of medical education. Some say in India, but particularly there are problems being cited about the foreign medical schools that accept Indian students who have difficulty getting seats in Indian schools. India tries to compensate that, from what I hear, with a super tough board exam that few people pass. So now there is a large cohort of doctors with diplomas from various schools around the world who have not passed the Indian board exam. What does that do to us? That puts those doctors and their patients in a very vulnerable situation. There are very few super specialty seats for postgraduate medical education, that is clinical. The Indian Supreme Court has decided to give 50% of the seats on reservation. That's quotas in the United States terminology, in the national exam NEET. So this is, according to doctors, this is a zero-sum game, and it destroys the morale of smart candidates. So I would, with all respect, I would say that this is very poor leadership in not breaking out and getting above this mess and solving the problems. People are dying. People are wanting healthcare. Why are they not solving these things? Let's get to the extreme expense. Well, there's a focus on so-called designer super specialty at the expense of basic medical attention. You all heard the stories where somebody goes to a doctor with bad cold, bad fever, and say, "You have a flu. I went to medical school for 8 years to treat you. Go away." Well,
Oh, yeah. I've heard that story countless times.
in the West, the extreme expense of medical education put doctors in deep in debt. You can't blame them. Once they come out, they're very deep in debt. So they then are driven to aspire to great wealth by the extreme expense of everything associated with doctors. So they charge extremely high fees and they spend extremely short interaction times with the patients. Okay, there's all kinds of excuses given, like, now there's a nurse practitioner and then somebody else and all these. The doctor just comes by and signs something and rushes off to the next patient. Doctors don't want to practice in rural areas. Now, I don't want to get into all the many reasons for this. I think if anyone has watched the Chevy Chase movie called Spice Like Us, there are some episodes there that might tell you the other side of it. It could be very dangerous to one's health to practice in rural areas. But the most cited thing is not enough income and not enough patients coming through to build up a portfolio. So rural healthcare access is very poor. Now, in the US, malpractice insurance premiums are ruinous because of extreme tort judgments. I mean, somebody has some problem. Next thing you know, you have been hit with $100 million uh, judgment, okay, and you're ruined. So many doctors have just quit. Sometime back in Georgia, where I live, you couldn't find an obstetrician because 100 or nearly 100% of obstetricians just quit. Okay, that's a case in point. The American Medical Association, some people say, has a fortress mentality that obstructs global competition. Notice in everything else, outsourcing, global competition, openness, etc., comes in, not in medicine. And that's very, very carefully defended. So they have convinced the American public that all medical care abroad is fraud or witch doctors or whatever it is. And so anything associated with medical care stays extremely expensive because foreign competition is made very difficult. Medical insurance is a monstrosity. So, despite the world's best technology, massive numbers of people in the United States have no medical insurance and no hope of healthcare. The what is called Obamacare, the Affordable Care Act system, was a small bridgehead, very hard fought, hard won, and even its harshest critics have been forced to acknowledge that it's at least an improvement on what was there. But it is also under stress, and costs are still rising. Medical costs rise each year much faster than inflation. I've never understood why that is so. Now, telemedicine is technically possible. I mean, how difficult can that be? In we have whatever 100 gigabyte, whatever it is, internet everywhere. It's possible, but most doctors do not even answer the phone or email, let alone consult via telemedicine, even at the height of the pandemic lockdowns. Okay, so that's where I said India was far ahead of the United States in those kind of things. Why? Well, they're afraid of malpractice suits. If you sign on and you actually talk to a doctor, you have to spend the first 30 minutes signing forms saying you can break my leg and I won't sue you, whatever it is. Okay, it's a fear of malpractice suits. So going to the doctor or hospital is extremely expensive, and many people delay or have no way of seeking medical help. This in turn massively increases the cost of treatment when they are finally taken to a hospital in a desperate situation. And then at that point, they are financially ruined, literally, or the state has to foot the bill. And of course, private hospitals do their very best to avoid treating such patients because they can't get a lot of money out of them. They can't recover their so called costs. On the other hand, the socialized medical systems in the United Kingdom and Canada have not conducted themselves with great merit in the past 2 years, to put it very mildly. Last item, very difficult for a researcher like me to talk about, but I have to say it: corruption in medical research. The aura of integrity, objectivity, and dependability of Western research in general and medical research in particular has taken a beating over the past few years as social media grew. Okay, some of it you can criticize as disinformation, this and that, but not all of it. People outside the medical community became aware of papers that had to be, much ballyhooed papers that had to be withdrawn from the hallowed British journal, The Lancet, and from this equally highly regarded New England Journal of Medicine. Looking into it, people started realizing that some of these journals charge $5,000 or more per paper publication cost. Okay, I'm glad to say that in my 45 years and whatever, I have never paid publication fees, and I have no intention of doing so. Somebody wants to pay me to write something, I'll think about it. Okay, but anyway, President Trump, remember, pulled the USA out of the WHO. He cited Chinese influence on WHO decisions, rightly or wrongly. But many people now regard the WHO as being beholden much more than it should be to the US Centers for Disease Control. Headquarters is in Atlanta. I've been there. And the CDC, in turn, has not had a stellar time either. Now we see a book by a former editor of the New England Journal of Medicine. I've not read it, but apparently he slams the pharmaceutical companies and cites the fact that 70% of research results published in his journal could not be reproduced by other researchers. 70%. If an undergraduate submitted an assignment done with such standards, she might be expelled from most universities. Let's just leave it at that.
Wow, Narayananji, I have to say this that whatever you have explained so far, this sounds pretty much in line with the experience of most people, of most people. So I'm going to turn to Nivedita. Nivedita, we would like to know, so what has India been doing in this regard?
Thanks, Anjali. Hello to everyone. I think my two co panelists have very lucidly explained the background of the whole thing. And let me put it in perspective. As you know, the past 2 years have really brought out both the need to re examine the system and to look at innovative solutions. And that's what Dr. Narayanan's solution is. It's totally innovative. There has been some success, and I'll explain that. Actually, the conference of July 2009 that Narayananji mentioned does seem ages ago, but I think we had a kind of premonition of things to come. And that's why we discussed the health
2019.
and wellness.
No,
Yes,
2019, Dr. Haran. Yes.
sorry. Yeah, 2019. Sorry, my apologies. And therefore, we discussed the health and wellness sector in such detail at that conference. I was present there. Now, early in the pandemic, the government recognized it as a national security threat as well as a grave emergency and reacted accordingly, the Indian government. The emergency care was stressed because there were very few mechanical ventilators, and many of those were imported systems, which were not functioning and had not been repaired. The Indian Council of Medical Research streamlined their processes to get new ventilator designs approved for manufacture indigenously, so that several major companies could react quickly. They also started training a corps of ASHA workers who would go out to the homes and check on people's health while they were under lockdown. Second, the Ayurvedic researchers have worked very hard to try to improve the immune systems of people. The approval process for such medications is very, very complex, as they are traditionally not suited to the mass statistics type of testing done by the allopathic pharmaceutical companies. But over time, through word of mouth, several such treatment regimes were established. People in India credit them with having countless lives, either through improved immunity, milder symptoms, improved recovery, or all of these. However, except in a few states, recognition has been very slow and grudging. Finally, actually, the focus placed on the Department of Ayush. Ayush stands for, it's an acronym for Ayurveda, Yoga, Unani, Siddha, and Homeopathy. It provided a quantum jump of sorts in the health sector. While recognizing these systems of medicine, it also brought out the need for evidence based practice and a holistic look at the health system.
That's remarkable. Brought out the need for evidence based practice. So I would actually turn again to Narayananji. You published a paper recently on an approach to resolve this mess. So, any comments?
Oh, thanks, Anjali. Being called innovative in my business is equivalent to having a target painted on one's backside, kick here, spit here, whatever it is. But I'll go ahead and see. This is what we a team of us. None of us were doctors. Actually, two mechanical engineers and an aerospace engineer, but we were high school classmates. We've seen more than 6 decades of life, and at least we have that qualification. So we suggested an approach. It consists of 5 points. First is make Ayurveda and allopathy into complementary, collaborative capabilities, not competitors. Except in friendly competition, okay, that's fine. It's not an either or solution in India. It is an inclusive, collaborative solution. Second point is that present Ayurveda graduates, as I found out with very, very good reliability, are trained in modern diagnostics. This is a fact that many people have, but did not realize. I didn't realize it. But they're not allowed to prescribe allopathic remedies yet. And maybe these bridge courses may allow that in certain situations. Ayurveda doctors are far more accessible. They charge less, but they're far more accessible. They spend much more time taking care of wellness rather than just immediate pain relief and things like that. Okay, and I can go into a lot of anecdotes, personal, close relatives, neighbor, etc., etc. But let's leave it at that. Anyway, they are very good first points of contact for rural India. And during these past 2.5 years, they actually have been on the front lines and really demonstrated their effectiveness. Now, the fourth is that diagnostic devices, as Dr. Nivedita mentioned, are mostly imported into India. And many of those very expensive things lie around. People call them Raman, Sita, and they're put in a corner and worshipped, and nobody knows how to use them, or maybe they don't work and they can't afford to fix them. But this is a fantastic opportunity for indigenous innovation and manufacture under Atmanirbhar, which should be taken up. Finally, the data needed for modern diagnostics should be India specific and indeed community specific, collected, used, and protected in India. If I may just take a moment to illustrate what I mean. A long time back, when I was a graduate student in the United States, so-called PIGS, Poor Indian Graduate Student, one of my classmates fell ill and went to the university's infirmary with its highly qualified doctors there. And they told him, look, I can't figure out, I can't diagnose what's wrong with you, because according to my book here, your skin, your face should be pale. But your skin is too dark. I can't make out whether it's pale or not. That is a real story. I mean, it may not be all so bad, but this is a need for community-based data on which to base many things. I've heard somebody declare that 85% of Indians have diabetes. And I said, look, if 85% of any community is sick, your data, the metrics are wrong. That's what is really sick. So anyway, those are the things I mean. We really need to collect India-specific data and use that. Something wonderful happened at the start of the COVID-19 pandemic. India set up a central government-run telemedicine portal called eSanjeevani. And I have heard several anecdotes of that from people I actually know. Absolutely free. Residents could simply sign in on their mobile phones. Of course, in India, everything is mobile phone. And be connected to a physician. And the initial people said, oh, I don't know. This is from my home state of Kerala, where people speak Malayalam. And they said, oh, I thought they would connect me to some Hindi wala from the north. But no, they didn't. They connected me to somebody in my neighborhood, in their own home state, who could speak their language. Free consultation, no waiting. The prescriptions were downloaded and filled locally. And it was like amazing. I read that and said, wow. in all that time, I could get an appointment with my doctor 2 weeks from now. Okay. That's all the best that we could do around here. Of course, it's not perfect. But more sadly, I haven't seen this advertised in the Indian medical community. And that is really shocking. The Indian medical community or industry appears to be not propagating this. I recently saw the statistics on how many consultations they're done. An impressive number, but for India, a dismally poor number. Okay. So this really reinforces some suspicions. In an expanded version of this system, India has trained so-called ASHA social workers. I'm not quite sure what the acronym ASHA stands for, except that it conveys hope. So these are social workers, and they were sent to people's homes. They actually went around to people regularly, checking on them, and they would then refer a patient via telemedicine. And they had both Ayurveda and allopathy doctors on call 24 hours. I know, again, from my discussions with doctors in India. This is a fantastic start to what we are proposing, but ASHA workers are not a real substitute for the expertise that an Ayurvedic physician can bring. Okay. So my frustration is that such terrific advances that are far ahead of the rest of the world have not been picked up and amplified 1,000 times by the Indian medical establishment. That attitude has to be changed. What are they waiting for? For the WHO and the New England Journal of Medicine to endorse this before they'll do something? That's very sad.
Yeah, true. And a very important lesson, Anjali, that the pandemic has taught us, and I said it earlier, is to rearrange our priorities for a better lifestyle, eating healthy, and staying fit, so that consulting a medical practitioner becomes the last resort. This is the basis for Ayush systems too. From an early age, eat a balanced, healthy diet, eat local and seasonal, stay fit through regular yoga and hygiene, and work continuously towards building body immunity. Now, all that I just said sounds quite close to common sense, doesn't it? And
Of
nobody
course.
would dispute it, not even an allopathic doctor. Most of us have grown up listening to our elders advising us in the same with the same words. But it
Yes.
cannot be denied that there are situations where certain types of biomedical tests are required, and invasive interventions and surgery is required, and that only an allopathic doctor can perform. So we have to keep that in mind. And what Professor Narayanan has been talking about, his proposal, is very workable. It is a patient focused uh, proposal, a system where there's a synergy between the various systems of medicine and getting the best from what we already have. When I travel through rural India, something I see which I had noticed earlier but never applied my mind to. There are a lot of privately run clinics, and I understand that they are all run by vets, and quite ludicrous, but they're all called Bengali doctors. I don't know why they are called Bengali doctors. I'm told that most of them are quacks. They don't have any degree, nothing. But people consult them. That means there is a major gap there. The PHCs are not able to cater to the requirements. Now, fortunately, over the last 2 decades, the systems under Ayush have developed a very strong course curricula, and there are now centers of higher learning that award medical degrees in Ayurveda, in Siddha, in Unani. But a lot more needs to be done. Take Indian cuisine. I think I'm diverting a bit. I have to mention this. Curcumin is omnipresent in our diet. But do you know that it does have health benefits? Eating certain seasonal vegetables, neem leaves, karela, nellika, papaya, even mango. Growing our own crops with no chemical supplements organically. I think these are some things that have to be brought about in our life changing systems. And apart from the bigger companies like Patanjali and Organic India, there are a slew of startups that are coming up in India these days. But testing these products under the Western system is a bit of a problem. And that, I think, a solution has to be found by our Ministry of Ayush. Because when you talk of evidence-based tests, how does how do you do it for haldi? How do you do it for mangoes? That's something that needs to be thought about. And there is no point saying that these are systems that have been practiced for thousands of years. That doesn't work. That's not how you can find a solution. That's all fine. We require tests done in present times. For it's only then that there can be basic standardization, and people's beliefs are changing, either due to personal experience or gathering more information. Why else would the export of turmeric infused tea, can you believe it, to the US has gone up by 4 times during the pandemic years?
So I have to say this thing. In fact, I have to admit it in front of all my audience that I love the turmeric tea. I have it very, very often, and especially when it's the flu season. So this brings me to our next question. What is India doing to improve its health parameters? I mean, you've given such a example of such a wide area of vegetables and everything, but I want to know what India is doing.
Yeah, I'll say something very practical, Anjali, if I may take that question.
Please.
As a country grows, there are many external influences that also impact its culture, its societal norms, our education, lifestyle, aspirations, food habits, and a lot more. India has seen the entry of many foreign influences over the last, say, 300 years. Some of these have become so overbearing that what used to be local and indigenous has virtually died out. It's been pushed out. Let's focus on our lifestyle and food habits. It is a fact that anemia is widely prevalent in children and women of childbearing age in India. Iron tablets is the immediate solution. But in the long term, let us rediscover what was there in the past. And while researching for solutions, look at that too. Let's not forget that. This is one of the major responsibilities of Ayush. Another example that I never tire from giving is the return of the coarse cereals, the millets, the what we call the bajra, the ragi, barley. These used to be part of our diet in India, especially in the rural areas, even until 100 years ago. But as foreign food habits took over, the coarse cereals got replaced by refined flour, polished rice, so much so that these became the symbols of good living. The nouveau riche. A child today asks for pizza rather than a matri made of millet. So, along with white bread, pizza, and pasta, let's also feed our children the traditional snacks and dishes from ragi and bajra. The time has come for some serious research on the usefulness of many of these naturally grown items, be it the brahmi or the curcuma or the artemisia anna, the quinine, as we say, which is supposed to be solution to a lot of ailments. Let's find those.
Actually, I have to admit one more thing, if you guys may allow, because you're talking about cuisine, and this is one of my favorite topics. Let me tell you that we have some of these. You mentioned millets, you mentioned bajra. We have some of these things, these grains available in a store very close by, Sprouts, which is the farmers market, and I do use them in vegetables. I just sprinkle some of it in cooked vegetables, or I cook vegetables along with it. So this practice is coming back exactly, and I'm going to actually move on to Narayanan ji, you, that what is this type of this type of holistic model that we are talking about. So what is the type of holistic model that you envisage to popularize this multi-model system for health and wellness?
Just before I get into that, just what you said reminded me that yesterday I was at the Costco department store. This is a place where people go to buy things in huge quantities. I was there to buy some medical equipment, actually. That it was much cheaper there than anywhere else. But we were waiting there, and there was this lady giving away this very big packet of something free, a free sample. And she did not offer one to me, unfortunately. But I saw that it was something to do with turmeric. So the turmeric is being popularized big time in United States. But getting back to this, what is the proposal that we have put out there to get people's reaction? I believe the first point of contact for patients, particularly in the rural areas, this may not be very relevant in urban areas where, as Dr. Sastry says, there may be many specialty hospitals and things like that. But in the rural areas, the first point of contact should be the Ayurvedic clinic, which may be located initially in panchayat capitals, but perhaps they should give facilities for the Ayurvedya to visit every village periodically. Mobile facilities should be provided. I mean, a van or SUV or something of that order should be provided with an internet connection, which is quite feasible today. The clinic and the mobile units should be equipped with modern diagnostics. And I'm not talking about huge, MRI or anything like this. I'm talking about things like temperature sensing, blood pressure, blood oxygen, the SpO2 gizmos that I have one at home, ECG devices, which you can, ECG, you think of lying on something and people sticking electrodes all over you. There's a tiny device that you can just put on your knee and hold with two hands, and it's a 6-lead electrocardiogram. It takes data into your cell phone. You can compare it with stored data that defines whether there's any abnormality. But that stored data is probably based on Caucasian populations, not Indian populations. This is where I'm saying those data need to be taken for Indians. But these are very cheap things. So these things should be brought to a level where most Indians can afford to buy them, or if not buy, borrow them as needed. Okay, and they should be available all over India, everywhere in India. Okay, and so I think this the link to modern diagnostics and then top class internet connectivity. Invest in 5G. It's a great reason to do this. It's not just for IT technicians and people like us who waste our time surfing the net. It's for things like telemedicine links to the best facilities all over India and indeed the world if needed. So these diagnostic devices, I suggested this to somebody in a state which I won't name, and somebody very high up said, "Oh, diagnostics." I said, "Look, we want to get the engineering colleges to develop them." He said, "No, no, no. If we need them, we'll import them." Okay.
That's the mentality.
Yeah. So see, here is where artificial intelligence technology should be brought to use and protect the data and tailor the treatment to local populations, uh, the history and the features of the population while maintaining links to the best in the world. If I might digress just a little bit, I know a little bit about these things enough to be dangerous. I've taken a course and I actually did a homework assignment on how to diagnose whether a electrocardiogram sample is normal or not using a deep learning system. So I kind of know what they're doing there. This is not. I mean, it's very practical. It's something that really should be taught and done in India. So anyway, that's my model. Very simple. Put the Ayurveda ahead, not allopathy ahead, and then let them connect to allopathy as needed.
So, Narayananji, you know what? I do agree with you 100%, but there is a need, to break this barrier between these different systems of medicine, right? So, if we want to make this project, of wellness centers a success, right? What is the best way to go about it?
I'll be glad to comment on it because I want to make it clear that I don't have anything to do with any government. And as I explained to somebody there, I try my best to keep the governments from taking any interest in me, wherever that is. But I believe that this is an area where government must uh, be proactive, and the effort should focus on implementing these things in the village panchayats first. I think the panchayat presidents in India, I've seen some of them, and they are a fantastic resource because, unlike the big politicians, they actually have to live in those villages. Okay, and that makes a very big difference. The cities can follow if they choose. So don't start everything in New Delhi or Mumbai or Chennai or wherever and expect the villages to just trickle down or get what is trickling down from there. Go and invest in the rural areas boldly first. Okay, don't look for endorsement from the cities. Don't try to get the cities to accept it first, as most urban Indians today actually seem quite oblivious to village conditions. This is something I've seen with shock. Even young Indians, they say, "What do you mean? There are places with no electricity." "Oh, no, no, everywhere." "Oh, yeah." Ah. Okay, so don't look for the cities to take leadership in this. Go directly to the villages. Recruit the panchayat presidents. Empower them. I pointed out somewhere that panchayat presidents of India are potentially much more powerful than the coat suit boot people that you bring on TV and say he's a CEO of this or CEO of that. These panchayat presidents have they are elected by 5 or 10,000 or more Indian citizens, and they control budgets that are very large. They can actually dictate to the CEO. So get them on the side of the government and get them to implement these things. Ayurveda people should be brought in by the example of opportunity given, and they should be given due recognition, but they should also be required to enforce the best standards of their profession. I have no illusions about this. That things can get very bad there too. So our paper suggested that the Ayurvedic clinics should be the first point of contact for most people, especially in rural India. Ayurvedic doctors should manage wellness care first, getting to know the people, and basic diagnostics. She should then coordinate treatment via the government's telemedicine portal, if nothing else, to reach any type of specialist anywhere. Okay, so ask for help. Don't try to solve everything yourself. Of course not. So a system that emphasizes collaboration and coordination, not competition. Let me just talk about my interest in all these things. I want to play with the devices. Okay, that's what keeps me busy. So my interest is in the diagnostic instruments and techniques. This is a field where Atmanirbhar is desperately needed and possible in India. So we suggested that the suite of diagnostics available to the clinic should be sharply improved, along with training being provided, and that all the diagnostic equipment should be developed and manufactured in India, including, very importantly, storing the data and using it for AI-based improvements. So,
I wish to add here, Anjali, that we plan to take up this proposal of Professor Narayanan and his team in at least 2 states to implement it in a systematic way and study the impact. Government of India had floated a proposal of which was something similar for converting our PHCs into health and wellness centers, but unfortunately, as it happens with the government, it hasn't really taken off. So this proposal is nothing totally new, really. We are talking about something that has already been suggested approved in the past, and it is in the same direction.
Well, I hope that this comes to fruition soon, and in India sees some more progress in this direction. So let me ask you, and this question is not to any one particular person, but what do you think that are some of the lessons that we have learned over the last, let's say, 2.5 years on wellness and health?
I think Dr. Shiv should go first. He's the real doctor around here.
And if Dr. Shiv can present some data, along with that, that'll be awesome.
Well, I have some data over here. I can read it out because what we've basically learned is that allopathic medical care is not going to cover the whole country. And we are really going to need alternate systems to cover healthcare all over India. And Dr. Narayanan was actually speaking of certain diagnostic equipment that is needed. I have some suggestions about the sorts of things that can be needed. I can help out because I have a fairly good idea of what would be needed in the rural areas. Primarily for our, I may not read out this data because this data looks, personally, when I looked at it, looks very boring to me. But let me just make some comments about what is needed. For instance, in the rural areas, the primary thing is maternal and child health care. And for maternal health care, you need ultrasound. And for ultrasound, you need ultrasound machines and ultrasound technicians. And for ultrasound machines and ultrasound technicians, you need electricity. And you can always have a technician to do that. And you can have an Ayurvedic doctor who takes the reports. And then it can be referred to a local obstetrics hospital, because the most important thing is obstetrics. And, we need to still cut down our maternal mortality and child mortality. So these are the sorts of diagnostics we need. Yes, endoscopes. We import endoscopes, and endoscopes are used widely, meaning, because, there's been a paradigm shift in diagnostics, especially with endoscope. In the old days, we used to have old days meaning, maybe 30 years ago, we used to have fiber optic endoscopes. Okay, that means there is a glass fiber from the doctor's eye right down into the patient. Now, these glass fibers are extremely expensive and they break. What you have now is a small camera, a little camera that goes down. So you can look inside. You can look inside noses. You can look inside ears. You can look inside the stomach. And you have these children with ear diseases and things like that. Equipped. And as Dr. Narayanan said, recording, because once you have a camera, it automatically gets digitally recorded. It's not something that the doctor looks at with with his eyes. So this is one thing. And if I may comment, on some of the things that have been discussed. I think it was said that we need to uh, have evidence, somehow bring in the evidence based uh, techniques into Ayurveda. You see, there is a very funny thing here, if I may say so. You see, this so-called demand of evidence based medicine has come from the West. Now what we are trying to do is take Ayurveda and say, you meet our standards. I am an allopath, you meet my standard. If you don't meet my standard, you're not going to work. See, this is the same thing. This is a serious problem. And I had written an article about, for instance, my grandmother used to follow what is called as muddy. Okay, what she would do is she would bathe and change into clean clothes, and only then would she touch food. Now, this is the same thing that is done by physicians. And if you look at operating theater technique, this is exactly that. The surgeon scrubs up, and after that, he can only touch other sterile things, and nobody can touch him. This is basic operating theater technique. And when you look, okay, and yeah, coming back to the original question, sorry for the digression. What have we learned in the last 2.5 years? You know, if again, about 20 years ago or 30 years ago, when I first went to the UK, I found that toilet tissue had the words, "Now wash your hands, please," written on toilet tissue. I mean, this is the most amazing thing. We're taught to washing our hands is something that we teach our children right from the beginning. Forget toilets, even before eating. And what did we learn with COVID? Wash your hands. And juta, this business of what we call Anjalee, when you don't take your food from the cooking vessel, taste it with your mouth and put it back inside. You don't share glasses. This is because your body fluids are going to the other person. So, these are things that the world has learned from us. But where was the evidence-based medicine? Where were the papers that were published in India? There were no papers. You can't say this is wrong because paper is not published. So this is something we need to rethink. Sorry, I'm done. If there's somebody wants to have a look at the
Not at
data,
all.
go ahead.
This was so enlightening, because these are the
Yeah,
things which we are taught in our childhood, that do not eat
yeah,
jutha. It's because of the
yeah.
saliva. And you, Dr. Shastri, being such a prominent doctor, and you coming up and telling us this, and in fact reiterating, re-emphasizing, because when these things are taught to us in our childhood, we think it's not very cool. We think
If I may just add something, people ask me, my friends who came from abroad, they used to ask me, why do you cook milk? We boil our milk. Why do why is milk pasteurized? You see, what happens is the cows, where the cow has bacteria, the bacteria gets into the milk. Okay, there are two reasons. One is India is a hot country. The milk is full of bacteria, and the milk will go bad very quickly. If you boil it, you kill all the bacteria. Even in the absence of refrigeration, the milk will stay for a day. Okay, if you keep it reasonably cool, or you keep it in a pot like they do in India, a clay pot. So this was one reason. Now, who told those people 5,000 years ago that there are bacteria and you need to kill the bacteria by boiling? Where are the medical papers? Where were the Lancets? Where were the British medical journals of those days? So, when we demand evidence-based medicine for Ayurveda, we need to change the way we think about, about the epistemology, about, where the source of this knowledge, where it comes from. Before, we are so, what shall I say, Macaulayized. We think in a particular way. We need to change our way of thinking. Thank you.
So I want to make if I might make a comment from
please.
a distant perspective. Ayurveda is often criticized for not doing proper research studies that can be recognized by allopathy-trained medical boards. That's true. Where are the statistics? There's a fundamental difference in approach. Ayurveda and allopathy, at their best, they are complementary systems with what I would call orthogonal capabilities. Okay. There is data behind Ayurveda, but those data are typically accumulated over a very long time, but often focused on a given community. Just as I said, the example where my friend didn't have a pale enough skin to be diagnosed properly by the doctor in the United States. I bet you that if an Indian Ayurvedic physician might have great difficulty really
Mhm.
diagnosing somebody from the United States who goes in there, because
I agree.
the background is so very different. So, in contrast, allopathy depends on contemporary statistics over a very large population, but it lacks specificity to any individual, other than very broad categories such as age, gender, race, body mass index, and all these kinds of things. So, allopathy also basically assumes that there is a unique causal relationship between the treatment input and the human body response. And I agree that this is because they're trying to get better at it with whatever they're doing in genetics and all these things. The human body is an extremely complex system. This is the engineering analog. When something is extremely complex, you put in an input somewhere, and the output that comes out is going to be very different from what you expect. There's no expectation of linear causal relationships and all these things. You take one pill, your temperature comes down by so much. It doesn't happen like that. So this is where I'll tell you my own experience as a type 2 diabetes patient for the past 20 years has taught me a great deal along these lines. Human body is very, very complex. That is where allopathy is trying to succeed, but is not perfect by any means. Ayurveda sometimes comes out with solutions that seem miraculous, but they are based on development over a very long time for that community. So that I just stop there.
I don't know how much more time we have because I can if I have a minute or so,
I,
let me just briefly say the difference between allopathy and Ayurveda, and it's like all
Please.
Western science. Yeah, it's like all Western science versus Indian knowledge. Allopathy, I mean, is like reductionism. They look at the individual trees in the forest. They don't consider the forest. Whereas Ayurveda considers the forest. It looks at everything right down from, the it sounds ridiculous, from astronomy, the stars and things like that, right down to the body. So it's a completely different system. It doesn't, basically Western science is a lot like, I think it was Richard Dawkins or somebody who said that, some things in science are like you smash a watch in order to see how it works. You take the watch, break it, you look at the individual parts and try and figure out how it works. Sometimes Western science works that way. We divide everything up into anatomy, physiology, this thing, that physics, chemistry, math, everything is in separate compartments. So there is a difference. We need to understand that. I'm
That
done.
is true. Yeah, that's why probably, these alternative medicine systems are more holistic in their approach. It's called holistic healing.
They're different. They are part of the, they are part of the whole. I'm not saying this is bad or that is bad. Both are needed.
Absolutely. I think we lost Nivedita, but
Yeah.
okay, she's back.
I'm sorry. Yeah, I'm sorry about that. Yeah,
No worries, no worries, it happens. But this was such an enlightening and interesting discussion. I would really like to thank our esteemed panelists for giving such succinct information on such an extensive subject like health and wellness. I mean, you people have touched upon every area and every aspect which is related to health and wellness. So thank you so much. I really, really so much appreciate you guys, taking time out and joining this. And, I really have to thank you for your dedication to, I would say, Bharat Mata and towards the betterment of our Indian brothers and sisters. Thank you so much. So, in the end, I just want to say one thing to our viewers. Health is not just about being perfect with food or exercise or herbs. Health is about balancing those things, balancing them with your feelings and desires. And it's also about nourishing your spirit as well as your body. So, taking care of your health and wellness and nurturing yourself is not selfish. It's essential to your survival and your well being. So, with that, have a very healthy and wonderful time. Until we meet next time for next episode, which is episode number 4. Have a wonderful rest of the day and weekend. Bye bye.